Hey everyone, we are back with our standard aesthetics, My Lady book, and we are still working on a lot of these chapters. I hope you guys are finding these videos helpful. We are going to continue with our chapter 5, which is going over skin analysis. All right, well, let's not waste any time and let's begin. Explain the process of skin analysis. Being knowledgeable about skin types and conditions is one of the most important competencies for a skincare professional. This interaction with a client sets you up as a skin care expert. The recommendation for the appropriate skincare treatments and products must be uniquely adapted to each person. The skin analysis is a determining factor in deciding what products to use during the service and what products to recommend for home care use. The skin analysis also confirms whether the client is an appropriate candidate for the treatment. Estheticians should study and have a thorough understanding of skin analysis because before performing service or selecting products, an individual's skin type and condition must be analyzed correctly to determine the appropriate treatment and products. A thorough skin analysis and client consultation is especially important to determine the cause of skin condition and any contraindications to treatment and product that the client may have. Using a holistic approach, identifying healthy habits and behavior is detrimental to skin health will give you a better understanding of how to help your clients. Remember, our goal is to treat everyone for their skin needs. Every individual will have different needs. Identify the 4 genetic skin types through visualization, palpation, and consultation. Skin type. Please highlight those first 2 sentences and put a star next to it. Skin type is a classification that describes a person's genetic. Skin's attributes. Skin type is determined by genetics and ethnicity. But like everything else, skin can change over time. Generally, skin becomes drier over time because our cellular metabolism and our oil lipid production slows down as we age. Skin type is based primarily on how much oil is produced in the follicles from the sebaceous glands and on the amount of lipids found between the cells. The T-zone is the center area of the face corresponding to the letter T, shape formed by the forehead, nose, and the chin. Evaluating the pores in the T-zone is the first initial step in determining your client's skin type. Highlight the following and put a star next to it. All skin types need proper cleansing, exfoliating, hydrating, and protection. Okay, we need to protect all skin types. Finding the right treatment plan to each individual can be challenging, and this makes the esthetician's role even more interesting. The focus of this chapter is to identify skin types, conditions. You guys, mastering the skills is necessary before learning about which products and treatments to choose for each person. When we perform skin analysis, we are using our visual abilities, often under a magnification, to note properties in the skin, such as pore size or irregularities in the skin, for example, blemishes. We use palpation to examine the skin through touch, manipulating it to determine conditions such as oiliness and elasticity. And we use consultation, conversing with our clients to determine their lifestyle and dietary issues that impact the skin. You will experience more success in your profession as your skills and assessment get stronger. And this is something that you will get with more experience and as you grow in the industry, in your profession in aesthetics. Skin types are categorized as follows. We have normal, combination, oily, and dry. Okay, so again on page 165, learning to identify skin types will help you formulate the best skincare treatment plan. The oil hydration balance is easily affected with combination skin. On figure 5.4, oily skin ages more slowly because the oil acts as a protectant to the skin. You guys, dry skin can have comprised transepidermal water loss. Normal skin often changes as we age. So although you may find yourself thinking that you have normal skin, your skin can change over time. And remember that we can all become sensitive at any point. All right, so normal skin type will be normal. What does it look like? How does it feel? How is it treated? Why? And what are the expert tips on page 166? So again, normal skin has a very balanced oil. Hydration is very balanced. The follicle size is relatively pretty small. The appearance is very uniform, okay? It feels very soft, smooth to texture, and it has very good elasticity, okay? How do you treat normal skin? So maintenance and prevention treatments. So although your skin is normal, you would still want to go in for routine facials, perhaps once a month. Use 4 steps to skin health. Cleanse, exfoliate, nourish, and protect. Remember, it's all about balancing. Why? Body systems functioning holistically for balance. Most common in 20s and 30s. All right, so the expert tips would be introduce anti-aging products as client matures. So again, it's never too early to start using anti-aging products and ingredients. Normal skin will often become drier with age, and reinforce the use of sunscreen. Okay, sunscreen is very important. All right, combination skin, put a star next to that, has an oil balance, moderate to high. Hydration would be good to maybe dehydrated at times. Follicle size will be larger in the T-zone than cheeks and sides of the face. Its appearance can have buildup of dead skin cells and oil in pores around the nose, but dry or flaky skin outside of the T-zone. Some blemishes and comedones. It feels oilier in the center T-zone than sides of the face. All right, how is it treated? Cleansing and regular exfoliation, water-based products, and avoid using harsh products and rough exfoliations. Why? Overproduction of oil in the T-zone may have normal oil production in the T-zone and dehydrated skin on the sides of the face. Expert tips would be evaluate often, as oil hydration balance can be disrupted by hormonal and environmental influences. So you will find yourself maybe feeling more oily or more dry. You know, it just depends. Reinforce again the use of sunscreen. All right, now let's get into oily skin. So oil, moderate to high. Hydration will be good to maybe dehydrated. The follicle size could be moderate to large. Remember, oilier skin types, their follicles are a little bit larger, okay? Its appearance, shiny. We know that it tends to look a little oily, right? Comedones and blemishes may be visible, present in the skin. It feels thick yet firm, uneven due to congestion, perhaps. How is it treated? Regular cleansing and exfoliation and hydrating with water-based products. Treatments to oil balance the oil production. Why? Overproduction of oil due to genetics, hormonal changes, medication, stress, or environmental factors such as skincare products or makeup that are comedogenic. All right, what else? Overexfoliation can create oilier skin as sebaceous glands work to increase surface dryness. Again, just because you have oily skin, it doesn't mean that you have to go overboard and over exfoliate your skin. If not, what's going to be happening is your skin is going to go into overdrive and start producing more oil. Again, that is why I say it's all about balance. All right. Clients with oily skin, breakouts, and comedones may have them on the neck, back, shoulders, and chest. Clients with oily skin age a little bit more slowly since the oil acts again as a protectant on the skin. Clients will need to use SPF regularly to avoid post-inflammatory hyperpigmentation. Dry skin, on page 167 at the top, put a star next to where it says dry. All right, so oil, very minimal, okay? Very minimal production of oil. Hydration, again, very minimal hydration. Follicle size, difficult to visualize. The pores are very fine and not that noticeable. Appearance can be a little dull, lack of luminosity, flaky, sometimes even a little blotchy. Feeling of the skin can be a little rough, thin, but yet very tight. All right. How is it treated? Oil-based products to provide protection of the acid mantle and increase the barrier function. Dry skin often has a comprised TEWL, which stands for transepidermal water loss, again, caused by evaporation of the skin surface. Treatment to provide nourishment and protection. You want to really nourish dry skin, okay? Why? Underproduction of oil due to genetics, again, environmental factors, and hormones as well. Expert tips. Dry skin may often be dehydrated. Can you imagine being dehydrated and dry at the same time? My goodness. All right, reinforce the use of sunscreen. Again, no matter what skin type, everyone must use sunscreen. All right. Next, differentiate the 6 Fitzpatrick skin types, okay, and accurately identify them. Developed by Dr. Thomas Fitzpatrick, the Fitzpatrick scale is used to measure the skin type's ability to tolerate ultraviolet sun exposure, UV exposure. Many skin treatments protocols are based on the client's Fitzpatrick skin type. Okay, so you guys, due to racially mixed genetics, there is no true phototype, okay, classification system. Therefore, the scale is just a simple guideline. Please remember that. When it comes to skin treatments, everyone's level of reactivity is obviously different. Lighter skin types are generally more sensitive. Individuals with dark skin have larger melanin deposits in the stratum corneum, which gives more protection from the sun, but dark skin types face other risks. Adverse reactions like hyper or hypopigmentation and keloid scarring may occur due to aggressive treatments. All right, so here is a sample on page 168 of the Fitzpatrick type, the Fitzpatrick scale. Put a star next to Fitzpatrick type number 1, which it's going over eye color, hair color, unexposed skin, heritage, again, hereditary, skin reaction to UV exposure. All right, so type 1 would be blue or green eyes. Hair would most likely be blonde or reddish. Always burns, peels with burn, does not tan, all right? They are at a very high risk of skin cancer, and obviously, again, sunscreen protection is necessary. Fitzpatrick's type number 2, blue, hazel, brown eyes. Hair, again, could be red, blonde, or brown. Unexposed skin would be very light, okay? Burns very easily, usually peels, tans minimally, okay? Type 3 will be brown, eyes would be brown, hair most likely dark. Unexposed skin will be fair to olive, tans well, burns moderately. Type 4 will be dark, dark eyes, dark hair, unexposed skin, most likely like a light brown. Tans easily, burns minimally, experience immediate pigment response. Type 5, put a star next to type 5. again, dark eyes, dark hair, dark brown skin perhaps, rarely burns and tans easily, okay, and usually stays tan for a long period of time. Type 6 will be, again, dark hair, dark eyes, rarely, burns and never burns, tans very easily, okay? So again, this is just a simple guide, all right, of the Fitzpatrick scale. Again, we come in all different genetic mixtures, different colors, so it's all beautiful, okay? But it's very helpful to understand the skin's ability to tolerate sun exposure. Regardless of what type you are, you have to remember that you have to protect your skin from the sun by using a full broad spectrum sunscreen, all right? Other skin classification systems. So there are other classification systems used when evaluating the skin, but Fitzpatrick is the most commonly used. They will ask you about the Fitzpatrick scale in your state board exam, so be very aware of it, and please make sure that you at least understand it. You may want to research other resources for information on the Glugo scale and the Rubin scale. All right. We are now on page 169 at the top. Distinguish the characteristics of sensitive skin. We are constantly bombarded by environmental stimuli, stress, sun exposure, and other unhealthy elements. Sensitive skin is a condition, but you can also be genetically predisposed. Sensitive skin is characterized by fragile, thin skin and redness. Please highlight all of that and put a star next to it. Clients with a heritage that is Northern European, Fitzpatrick skin type 1, tend to have fair light color skin that is thinner and more sensitive. It flushes easily and may appear red due to the blood flow being closer to the surface. Individuals with multicultural skin can also be naturally sensitive without the visible redness. Sensitive skin is easily irritated by products or by exposure to heat or sun. Telangiectasia, okay, that's another key term that we have seen and talked about in other chapters. Again, telangiectasia, visible broken or distended capillaries less than 0.5 millimeters due to intrinsic or extrinsic causes may be noticeable on sensitive skin. So if you have distended capillaries, if you are pretty fair skin, they will be more noticeable on your face. These conditions are a proactive visible reaction to let us know that something is irritating the skin. All right, that's just the skin's reaction. Fragile or thin skin can also be the result of age or medications. Skin can become reactive, you guys, and sensitized from exposure to things such as harsh products, heat, or even become dehydrated and chapped from cold weather. Sensitive or yet sensitized skin can be difficult to treat because of the low tolerance to product and stimulation. So for example, excessive rubbing, heat, exfoliation, or extractions can cause damage and increase redness. Sensitive skin needs to be treated very gentle with non-irritating, calming products and treatments. It is important to find out what could be causing sensitive conditions by completing a very thorough skin analysis. It is a natural part of their skin condition, or is it something the client is exposed to that is causing this? Primary treatment goal for sensitive skin, again, is to soothe, calm, and protect the skin. I love it. I am here for it. All right, next page. Recognize the intricacies involved with treating skin of color. All Fitzpatrick skin types have the same number of melanocytes. Higher Fitzpatrick skin types have melanocytes that produce more melanin. Melanocytes comprised about 5 to 10% of all the cells in the basal layer. Most of the differentiation, it depends on the ethnicity of the individual and their geographic location. A person who lives along the equator will have much more active melanocytes than the person who lives at the North Pole. In addition to these considerations, each of these skin types have specific characteristics. All right, let's talk about Fitzpatrick skin type number 4. Considered to be one of the most challenging skin types to treat well, has great elasticity and firmness, and does not show signs of aging as quickly as Fitzpatrick skin types 1 and 2. It can become hyperpigmented from treatments or aggressive exfoliating agents. Gentle exfoliating products are recommended. May need to add melanin suppressants or other skin lighteners to their skincare routine. Put a star next to the following. Requires sun protection to slow down hyperpigmentation. Must avoid sun exposure and use sun protection daily, especially for anyone prone to hyperpigmentation. Fitzpatrick skin types 3 and 4 typically have thicker skin that is usually characterized by more oil production and need more deep cleansing treatments. Additionally, waxing is more difficult for individuals with this Fitzpatrick skin type that has thicker hair and thicker roots in the follicles. If you want to specialize in skin of color, explore educational resources and advanced classes for this area of study. No matter what a client's skin type or ethnicity background, everyone needs an individualized skincare consultation and treatment plan to maintain healthy, beautiful skin, no matter the Fitzpatrick skin type. Fitzpatrick skin types 5 and 6, they generally have oilier and thicker skin, but have the same level of reactivity as someone with a lower Fitzpatrick skin type. Reactions may be more challenging to see on darker skin, but they may be just as intense as those on lighter skin. Are prone to a form of hyperkeratosis, so therefore they need more exfoliation and more deep pore cleansing. May have abnormal hypertrophic scarring such as keloids. You guys, sun protection is still very much so necessary for this skin types. Again, I repeat, I know I sound like a broken record, but it does not matter your Fitzpatrick, okay? Whether you're a 1, 2, 3, 4, or a 6, everyone needs proper sun protection. All right, we are now on page 171. Identify treatment options for the neck and décolleté. Highlight the following and put a star next to it. The skin on the neck and décolleté is not the same as the skin on the face. The neck and décolleté have fewer sebaceous glands than the face, so they tend to show signs of aging more quickly. The neck and décolleté are more susceptible to irritation. Photo damage, broken capillaries, fine lines, and rhytides, wrinkles, develop just as much on the neck and chest as on the face. Okay? You have what is now called tech neck, a new phenomenon caused by the repeated movement of looking down at a cell phone or other electronic devices has created a demand for specialty topical treatments that include antioxidant growth factors and serums and additional moisture. Be cautious when applying vitamin A or AHA and AHA products that may cause excess irritation to that specific area. A product such as a retinol may be fine for the face, but may be too aggressive for the neck. Remind your clients that the neck and décolleté, again, need SPF protection as much as the face does. All right, page 172. Illustrate examples of skin conditions. Many internal and external factors affect the conditions of a person's skin. Skin conditions are more than our genetic makeup. These conditions are what the esthetician is most concerned about, and they are the focus of skin treatments. Highlight the following. Some of the most common skin conditions estheticians see today is adult acne, extrinsic aging, again, this is from sun exposure and the environment, and problems related to hormonal fluctuations, dehydration, which is the skin's lack of water, and pigmentation disorders are also significant concerns of our clients today. Other skin conditions include comedones, hyperkeratinization, and erythema redness. We can improve some of these conditions through regularly scheduled skincare treatments, by using specialized products, and by avoiding the factors that affect the condition. On the client's chart, you will want to note other conditions that may not be listed in and that you learn about here and in chapter 4, disorders and diseases of the skin. All right, so again, skin conditions and the descriptions here on this chart. I'm not gonna go to all of these, but please do not ignore the chart. I will say to put a star and a highlight where it says asphyxiated skin, which is smokers have asphyxiated skin from lack of oxygen, characterized by clogged pores and wrinkles. Dull, lifeless looking skin can be yellowish or even gray in color. Again, please do not ignore all the terminology that is on page 172 and 173. Also put a star and highlight the word milia. Milia is a heart and pearl-like collection of oil and dead skin cells trapped beneath the surface of the skin. Milias are not exposed to oxygen and have to be lancet to open and remove them. Milias are typically the size of the head of a pin. So yeah, there are some states that do not allow estheticians to extract milia. So that's that. All right, next page 174. Again, there is more terminology on this chart. Some of these we actually already went over on chapter 4, diseases and disorders of the skin. So some of this should definitely be more like a review to you, but again, don't ignore it, go over it. Again, if you need to make flashcards to help you remember some of these terms, please go ahead and do so. All right, explain the causes of skin conditions. Being aware of what can affect the skin will help you determine why a client may be experiencing problems. Often skin conditions are due to more than one influence, okay? The esthetician must evaluate multiple causes, both external and internal, to correct or improve a skin's condition. Each client is different, and the skin of various clients may respond differently to the exact same treatment. Again, that's why it is not a one-size-fits-all, okay? It is definitely not. All right, bottom of page 175. External factors that affect the skin. You guys, habits, diet, and stress all play a part in our health, which in turn is reflected in our skin's appearance. Skin conditions can be caused by allergies, reactions, medication, medical conditions, and other external or extrinsic factors, okay? Additionally, lack of exercise, lack of sleep, smoking, medication, and drugs will have negative effects both inside and out. Sun damage is the main external cause of aging. I repeat, sun exposure is the main external cause of aging. All right. These factors can also contribute to skin problems and can be detrimental to maintain a healthy and attractive complexion. As you read through the following chart, you can understand why correct skin analysis and product and treatment recommendations are very important. All right, external effects on the skin. Again, UV exposure, sun damage, tanning beds, environmental exposure, pollutant, obviously the air quality, the environment, climate, humidity, poor maintenance, inappropriate skincare. You will be surprised how many people out there buy products that is not necessarily for their skin type, and they're actually doing a reverse effect on their skin by not having the knowledge and using the wrong skincare products on themselves. All right, seek an esthetician, you guys, if you're watching this and you're not in the industry. All right, again, it's here. Misuse of products or treatments, over-exfoliation, harsh products. Put a star next to that. All right, allergies and reactions to environmental factors or products. Photosensitivity, you guys, to the sun from medication or products. All right, internal factors that affect the skin. So our body's internal or intrinsic health affect how we feel and how well, as well as how our body and skin look and perform. Free radicals in the body, dehydration, again, lack of water, vitamin deficiency, improper nutrition, genetics, hormones, puberty, pregnancy, menopause, all affect our skin's well-being. Hormonal imbalances can lead to sensitivity, dehydration, hyperpigmentation, and microcirculation problems that affect capillaries. All right, on page 177, describe healthy habits for the skin. Top 10 healthy habits for the skin will be avoid sun exposure and obviously using sunscreen daily. Eat a balanced diet. Do not smoke. Put a star next to avoid excessive alcohol. Drink plenty of water. Get plenty of rest. Stay active and exercise regularly. Use beneficial skincare products in a regular home care routine. Get professional skincare treatments to maintain the result of your home care regimen, and to more effectively treat the signs of aging, blemishes, or other skin conditions, or obviously any other type of concern. Implement stress relievers and maintain a calm, positive attitude. Positivity to all, okay? That's our motto. All right, bottom of page 177. Determine treatment contraindications through evaluation, analysis, and consultation. All right. Certain treatments and skincare products may be contraindicated for a particular client, and it is your responsibility to evaluate the appropriateness of treatment and skincare products after your skin analysis and review of the client's medical history. These contraindications are factors that prohibit a treatment from being performed, okay? Or the use of certain skincare products being used on a client's skin, okay? Certain treatments could cause harmful or a negative side effect to those who have specific medical conditions. All right, you guys, so put a star next to that and highlight it. Communicable diseases, skin disorders, medical conditions, medication, and skin irritation can all contraindicate or prohibit a service or use of skincare product. The client may list a communicable disease on the client's questionnaire. Recognizing diseases is vital to avoid causing harm to clients or to you, okay? We went over, again, diseases and disorders of the skin in the previous chapter, which is chapter 4. Medications or topical exfoliating agents may make the skin too sensitive for facials or waxing, okay? Certain medical conditions, illnesses, and diseases such as cancer may contraindicate any stimulation to the face or body. Allergies and sensitivities to the skincare products must be evaluated. Clients who have obvious skin conditions such as open wounds, cold sores, or other abnormal looking conditions should be referred to a medical provider for an evaluation and approval for an aesthetic treatment. Contraindications are also discussed in other chapters. On page 178, there is a chart of different contraindications for skin treatments. I'm just gonna go over a few of these, but obviously, again, do not ignore this chart. At the bottom, the use of oral steroids, put a star next to that and highlight it. Avoid any stimulating exfoliating treatments or waxing. Anyone that has an autoimmune disease such as lupus, vitiligo, avoid any harsh stimulating treatments or skincare products, okay? You have to make sure that you get an approval from their primary physician, okay? All right, on page 179, client consultations. A thorough client consultation is important for many reasons. The most important is to determine that a treatment is appropriate for the client, okay? Or that the skincare product will benefit the client's skin. A consultation will help you to determine why a client may be unhappy with their skin or its appearance. You guys, health, lifestyle, occupation, and more affect the skin. Sometimes estheticians are like detectives, trying to determine why the client is having a certain skin problem. The more you know about your client, the more you can make appropriate recommendations for skincare and treatments. Reminders on how to prepare for a client consultation. All right. Is the client comfortable? You are about to begin an important conversation with them that will clue you in their needs and preferences. Is your work area freshly cleaned and uncluttered? Are all other appropriate tools to perform the desired service ready for use? Do you have a pen or a laptop or a tablet along with vendor supplied or a salon manufactured pamphlet, photos, articles, anything that you may need during your consultation? Make sure you have those in hand. Do you have a step-by-step photos of the actual treatment process? Photos can be helpful in letting clients know what to expect. All right. Will you be able to discuss whom the best candidates are for specific treatments to help decide if the treatment is suitable for a client? All right, something else that's very important during any treatment would be intake forms. All right, please highlight all of that and put a star next to it. An intake form, also called a client questionnaire, which has health history forms or consultation cards, okay? This form discloses the client's health history, all products and medications that they're using, any known allergies or sensitivities, along with their at-home skincare program and skincare treatment the client has recently received that could obviously affect treatment. Information should also include important details about the client, including their name, age, what they do, diet, lifestyle habits, all of that. Again, the more you know, the better. All right. And again, this is just a sample of what an intake, a medical form would look like. All right. You would obviously want to create one that works for your practice. Okay. And for the different services that you offer. Then we have a consent form. All of these are very important, okay? Keeping record and making sure that you have these put away, locked away safely is also very, very important, okay? All right. Again, consent forms, client charts, service record card, okay? How to use the client intake form. The client intake form, again, should be mentioned the moment that the client schedules an appointment. You want to let them know to arrive anywhere between 10 to 15 minutes before their appointment to fill out this paperwork. I know nowadays not everyone uses paper, so if you have all these forms uploaded with whatever booking system you use, this is something that you want to make sure that your clients fill out before their appointment. That way you can review everything. If there is anything that is contraindicating for the service that they are booking for, you can let them know ahead of time. So again, this is just all very helpful information about all of that, okay? Questions to ask during the consultation. What is the reason for your visit? What are your skin concerns? What are your goals for your skin? What is your home skincare routine? Do you have one? You will be surprised as to how many people do not have a home skincare routine. Treatments before? Do you have allergies to products or any type of scents? How does your skin feel during different times of the day? Do you wear sunscreen? Do you want to find out how much outdoor activities they do? Do they smoke? Again, of any known allergies that they might have. The skincare consultation and skin analysis is your moment. Okay, it is your moment to make the client aware of what you are noting, okay, about their skin condition and what services or products you offer that could benefit them. The consultation is also a marketing and an educational opportunity to the client. Once you learn about ingredients and start performing skincare treatments, you will be recommending products to your clients. Think about how you can help the client through treatments, home care suggestions, and preventative measures. Conduct the consultation, discuss what you see with your client, and give recommendations during the analysis or after the treatment. That's completely up to you. It is beneficial to practice skin analysis before diving into product and treatment. Each subject you study gives you a foundation to build upon for the next step, you guys. That is so true. All right. On the next page, which is page 188, it is talking about performing the actual skin analysis, all right? Knowing how to analyze the skin is the first step in providing a successful skincare treatment and recommending effective skincare products. Identify conditions and contraindications, as well as providing a thorough consultation and charting clients' notes, are all elements of a good aesthetic practice. Educating clients on healthy habits and the causes of skin conditions is part of the service. Products, ingredients, different types of facials, and caring for their skin, okay? Even if there are no obvious visible change, skincare treatments have positive benefits and make a difference. Information on choosing products for treatments and home care is presented in Chapter 6, Skincare Products, Chemistry, Ingredients, which we will be going over next. All right. Soon you will automatically notice skin conditions. The more you do, the better obviously you become. All right. And that's how you start building experience. You will become very quick at doing skin analysis in the waiting room because sometimes clients need quick product recommendation or are not sure as far as what type of treatment they should receive. This skill can be very beneficial in selling products and treatments. You can perform a more in-depth analysis when the client obviously comes in for an actual treatment. Knowing skin types, conditions, and the factors affecting the skin's health, as well as interviewing skills that encourage your client to open up about their skin care regimen, enables you to perform an accurate skin analysis. The best tool for analyzing the skin is a magnifying lamp or light, a Woods lamp, which is a filter black light that is used to illuminate skin disorders, fungi, bacterial disorders, and deeper levels of pigmentation, or an electronic photo imaging system. There's technology, you guys, it's a lot. There are a lot of different things that are being used today for skin analysis. There are other handheld tools such as a moisture analyzation meter and devices that magnify hundreds of times are available to analyze the skin. Here's my theory. No matter what type of technology is out there, you definitely want to be able to do a very good skin analysis by asking your clients questions and really seeing what you are able to see with the naked eye and making sure that you are obviously able to communicate with your client and what you see and what best suits their skincare needs. versus really depending on a machine to do it for you, right? They're cool and all, but at the end of the day, you want to make sure that you're able to perform a skin analysis very well. Client information is personal and confidential. So be objective when you write on a client's chart. Clients will appreciate you remembering their children's name or their recent trip to Hawaii. So try to recall some personal information the next time they come in, and keep it in a separate file for your own personal references. Again, it's just to making them feel more comfortable. All right, your record could be legal documents in a dispute with the client. So write legally, make sure you date all entries and sign your name. Review the steps to performing a skin analysis in Procedures 5.1 and demonstrate your abilities to your instructor as set forth in the guidelines. Okay. All right. So on page 190 is where it starts to show different pictures and obviously the different steps on how to perform a skin analysis. On page 191, please highlight where it says, use a magnifying light to examine the skin more thoroughly. A Woods lamp or an electronic imaging system may also be used. Again, I'm not going to read all of this, but please make sure that you guys go over this, all right? On page 192, please put a star and highlight number 7. Look closely to determine the client's skin type, the conditions present, and the overall appearance of their skin. You know, this chapter is actually not very difficult. Again, I feel like the more we have gone over other chapters, it's just putting everything into perspective. Everything is connected. So again, please review this more than once if you are studying to pass your state board written exam. Yes, you will have questions over skin analysis on that test. So make sure that you are reviewing this chapter thoroughly. Again, they are going to ask about the Fitzpatrick scale. Again, all of this information is very important. I hope all of this has been very helpful to you. And like always, I will see you on my next one. Bye.